Welcome to the Nursing Post podcast, all nursing all the time with Ashley Moore and Rosa Horsley. Today's episode is all about cord blood. Our goal is always to inform and start conversation.
The first cord blood transplant was in 1989 and was done at a hospital in France using sibling-matched cord blood to treat a 5-year-old with Fanconi anemia. And this patient is still alive and well today. Maybe some of you have heard about cord blood or even cord blood banking. We wanted to explore this topic a little further and give you the good, bad, and indifferent. Cord blood equates to stem cells and stem cell transplant, which is what a lot of this is going to be talking about.
There are some stats and facts. Cord blood is full of life-saving stem cells. Without controversy, we all know that that's a fact.
Yes.
So there's nothing to argue there.
And we did an episode about a year ago on stem cells that talks a little bit about the controversy behind it if you want to listen to that.
The collection of cord blood does not harm the mother or the child and does not interfere with the birthing process. No controversy with that either.
Right.
Facts. Umbilical cord blood is currently used to treat over 80 life-threatening illnesses like different types of cancers, autoimmune, and genetic disorders. Facts.
Yes.
Research is looking bright for cord blood stem cells to be used in regenerative medicine, helping to treat autism, cerebral palsy, spinal cord injury, hearing loss, diabetes, and the list goes on. Over 35,000 patients have had cord blood transplants since 1989. In the U.S., fewer than 5% of births collect cord blood. Now, that might leave me with a little bit of an indifferent, not indifferent, but a bad
I was surprised
feeling
that it was
about that.
I think it's because people don't know about it.
Yeah, I feel a certain type of way about that. In 2003, the first successful case of sickle cell anemia was cured using cord blood. And since tissue types are inherited, patients are most likely to match someone of their own race or ethnicity. Today, there are not enough registered marrow donors of diverse racial and ethnic heritage. These donors are especially needed. Black or African American, American Indian or Alaska Native, Asian, Native Hawaiian or Pacific Islander, Hispanic or Latino, or anyone of mixed heritage.
Which makes me wonder because I would consider myself white or Caucasian, but aren't we all mixed in some sense?
From your lips to God's ears.
There are two different options when it comes to cord blood. You can either collect it or discard it. If you choose to collect cord blood, then the other decision becomes whether you want to just donate it to a public bank or if you want to keep it for your family and bank it in a private agency. If you choose to keep the cord blood private for your own family, which means nobody would use this until you want to use it, then there are fees involved. There's a collection fee. That's going to be $1,200 to $1,500. And then there is a yearly fee, $150 to $300. I mean, that varies per agency.
Basically, you're paying for storage space.
That's exactly what it is. And there are many private banking options. So you really want to make sure that you do your due diligence in picking the correct agency for you and your family. There is a little bit from what I've read of what you get what you pay for. And that's all I'm going to say about that.
Do your research.
Do your research. Absolutely. And public banking options are free. They can be used by any person in need for research purposes, but you do not get to choose what your cord blood is used for. So ultimately, if you decide that you want to donate your cord blood, the baby's cord blood, I don't know.
It belongs to both of you.
Yeah,
you both were using it.
I'm not really sure.
You both were using it.
I'm sure there's a correct term for that. But if you decide to donate cord blood, then that's completely free. There's no cost for collecting and there's no cost for banking it. And it will be used by anybody for like a cord blood transfusion or transplant, or it'll be used for research. And a lot of that depends on the amount of blood that they're able to get out of the cord and the placenta.
Do you ever remember being offered to donate yours?
I am so glad you asked.
Because in my mind, and I've had 2 children, they're 10 years apart.
Mm-hmm.
Not the first time around was I asked if I wanted to keep, store, or donate. And the second time around, granted, I was under a lot of mag-sol.
Right.
However, I do not remember being asked.
No, and you will not and should not be asked at the time of delivery, because at that point, that's not the focus. Okay. The baby and the mama are.
Well, yeah, but even after, it has to come out of you.
Yes.
After.
Yes.
I was never asked even then.
And so what is supposed to happen is you're supposed to know about this option, and you're supposed to bring it up with your OBGYN between 24 and 36 weeks of pregnancy.
Oh, so you're supposed to know about it. They
Yes.
don't ask you.
No.
You're supposed to know.
Correct.
Wow.
And I think that's why that number is so low in the United States. If somebody would have been like, do you want to donate your cord blood and your, placenta blood? I think they just call it cord. It's all the same.
It's all the same. And it's all in one thing.
Right. So do you want to donate that? I would have been like, what else would I do with it? Throw it away?
Yeah, I would have definitely donated it. If not, it's going into the trash.
Exactly.
That is
And
that
I
is
don't
crazy
care if
to
you
me.
use it for research or if you use it for somebody who needs it. It doesn't matter to me because it was going in the trash.
I kind of feel a little salty right now and in my feelings about it, because how many lives could you have saved had somebody asked you?
Right. And my thing of it is so many people will say, well, I don't care what you do with it. You want to donate it, that's fine. Donate it. At that point, how many people would automatically donate it because they don't need it? They know it's going to go in the trash.
Me.
I would. You would have. Then we have two different diverse people here by two different racial or ethnicities that could either have been what somebody needed for research or what somebody. So say they took the blood out of the cord blood for my child and they took it out for yours, but they didn't get anything out of mine because I was having issues with bleeding. Okay. Fine. Whatever. They would probably take that little amount and just use it for research. As to where if they get a larger amount, that's probably better used for treatment options. So maybe yours would have went to maybe somebody for treatment. You don't get to choose, which
so sad.
If you were throwing it in the trash, why do you care anyways? I don't know. Maybe somebody has an opinion and I would love to hear what that is. Maybe I'm not being as open-minded as I do try to be.
Not even before I gave birth was I asked.
And that's when they say, you need to bring this up with your OBGYN between 24 and 36 weeks. And I was just like,
they don't ask me to.
I'm a nurse, and I've never thought about the blood that's in the cord.
I didn't either, but let me tell you what. My OBGYN tells me about my mammograms. I'm just saying. She tells me about the pap smears and, your monthly breast checks. Like, I'm having a baby here. You could at least let me know. Well,
and the thing of it is I did think, I'm like, okay, well, my first child I had at a smaller hospital in our local town. Maybe they don't have that option. But my second child I had at a teaching university.
Yeah, I had my son in the Tidewater area, and that's nothing but teaching. And I still wasn't offered.
Right. And so I'm just like, this is just crazy to me that we're throwing away something that has been used to cure people.
It's life. We're literally throwing away life. It's astonishing to me.
It really is.
So there are a couple of things that you want to watch out for when you think about cord blood banking. There can be false claims as to what stem cells and cord blood are currently capable of treating. There are some people that are just so crooked and devious that they will mislead patients to bank cord blood for future use of treatment that is either being researched or hypothecated, and it's wrong and illegal. If you recall from from a lot of episodes back.
About a year ago.
Because now I don't, we're on past 60 here. We even mentioned in a previous podcast that there is a government federal website that you can go on to find a list of appropriate stem cell places for treatment and storage facilities for cord blood or stem cells.
There's a lot of hope for stem cells. There really is, because the magic behind these stem cells is they can become anything, right? So that's why everybody's like, oh, stem cells, yay. And one of the places that we got stem cells from that nobody really wants to talk about is from in vitro.
Absolutely.
And the cells that were not used to fertilize the egg are destroyed. And some people feel that is destroying a life. They don't want to use that as a source of stem cells. And so this is why it's controversy free, is because, the cord and the placenta have already served its purpose.
It brought life into the world.
It's done.
Yeah.
You're throwing it away. There's nothing to do with it. That's the great part about this. And it's free. We just don't know to ask for it. I think that's the problem. We just don't know to ask for it. I would have thought that this would be something that would be routinely brought up, but it wasn't brought up for me in either one of my pregnancies at 2 very different locations. And the same thing with you. You had 2 very different locations, 2 kids,
many years apart.
Mine were 4 years apart. Yours are 10 years apart. We haven't heard anything about this.
I had no idea. Honest to God, I had no idea. It's kind of infuriating.
Mm-hmm.
But there's new research that you're going to tell us about.
Yes. So there was a recent study done at the University of Colorado Cancer Center showing some pretty good response when it comes to cancer patients needing bone marrow transplants. So out of 313 patients receiving bone marrow transplants, 123 patients receiving transplant from the gold standard, which is a matched sibling donor. There were no differences in survival outcomes between the 2 approaches. So one being the gold standard and the other being the cord blood.
Mm-hmm.
Okay. There were some differences. There were significantly fewer complications due to chronic graft versus host disease in patients using cord blood, and a slightly lower rate of relapse in patients receiving transplant from cord blood. Now, the cord blood was not their sibling, okay? The cord blood was somebody from the bank that just matched.
Mm-hmm.
And so they're seeing now that there's even a smaller subgroup of those patients that receive the cord blood that are actually doing better.
Nice.
Than the ones that received the sibling match donor.
Nice.
The sibling match donor was or is the gold standard for these transplants because, hey, it's, you have the same mom, you have the same dad, you have the same genetic makeup, your blood types match. You should have less chance of rejection, which is what that, graft versus host disease pretty much is. And so at this point, they're seeing, whoa, hold on, this cord blood even did better. And it's because the cord blood doesn't have as many proteins in it, and so there's nothing to
reject
or there's less to reject.
Absolutely.
And so because of that, it's taken better, and now patients seemingly are doing better with it.
I just love technology.
It is. It's pretty cool.
Every year something comes, and it's just astonishing.
Yes. And right now they're working on cord blood with autism, cerebral palsy, pediatric stroke, and acquired hearing loss are the studies that they have going on right now to see how things work. I did read a small study, a big one. Well, it wasn't a small study, a recent study from Duke about autism where they give children with autism cord blood transfusions just to see if it made a difference to give them cord blood. And I'm like, how in the heck is that going to change anything? Like, that didn't make sense to me.
I kind of find it, I'm excited that they are trying to study it, with patients and autism, which we've also done a podcast about. And we also know that from that podcast, the general age of diagnosis is later than 2. Right. But as early as 2.
Right.
So I'm not really sure how they would even be able to. I don't understand the study.
No. And it wasn't necessarily a positive study. It didn't show any significant difference. But they did realize that I think that the group that they were studying wasn't the ideal group. And so it's still being researched. So it's a big thing on it. And it's a study that was done at Duke. You can look it up quite easily. But it's nice to see that they're actively working
absolutely
on all these things.
Well, I'm hoping with this podcast and with us putting the word out on the street, so to speak, that a lot of pregnant mothers know their options.
Yeah.
Because I would have loved to have known about it, because my son is autistic. I don't know what they're using this studies for, but would have been nice to think that, it made a difference instead of going into a biohazard receptacle.
Well, the thing of it is I'd rather it go into failing research because
At least they tried.
Again, you're in my brain. Because at least at this point, they tried to do something versus just throwing it away. Because what they're going to do something one time, they're going to be like, oh shit.
They're going to find it.
Look what we did. And that's what we need. But in order to do that, we have to have
it.
We have to have the product.
Absolutely. To get more information about cord blood donation and banking, it's important that you speak with your OBGYN. There are options if your hospital does not offer this service. However, it may take more effort. Donating cord blood can save a person's life and be able to offer them a transplant that otherwise may have never happened, especially for ethnic minorities.
You can find our references on our website, thenursingpostpodcast.com, and be sure to subscribe to our podcast on your favorite platform. We love to hear your thoughts and comments. Thanks again for listening to The Nursing